Kidney stones, renal lithiasis, nephrolithiasis, are small, hard mineral deposits that form inside your kidneys. The stones are made of mineral and acid salts. Kidney stones have many causes and can affect any part of your urinary tract, from your kidneys to your bladder. Often, stones form when the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful, but the stones usually cause no permanent damage. Depending on your situation, you may need nothing more than to take pain medication and drink lots of water to pass a kidney stone. In other instances, for example, if stones become lodged in the urinary tract or cause complications, surgery may be needed. Your doctor may recommend preventive treatment to reduce your risk of recurrent kidney stones if you are at increased risk of developing them again. Signs and symptoms. A kidney stone may not cause symptoms until it moves around within your kidney or passes into your ureter, the tube connecting the kidney and bladder. At that point, you may experience these signs and symptoms. Severe pain in the side and back, below the ribs. Pain that spreads to the lower abdomen and groin. Pain that comes in waves and fluctuates in intensity. Pain on urination. Pink, red or brown urine. Cloudy or foul-smelling urine. Nausea and vomiting. Persistent need to urinate. Urinating more often than usual. Fever and chills if an infection is present. Urinating small amounts of urine. Pain caused by a kidney stone may change, for instance, shifting to a different location or increasing in intensity as the stone moves through your urinary tract. Causes. Kidney stones often have no definite, single cause, although several factors may increase your risk. Kidney stones form when your urine contains more crystal-forming substances such as calcium, oxalate and uric acid than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. Types of kidney stones. Calcium stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate. Oxalate is a naturally occurring substance found in food. Some fruits and vegetables, as well as nuts and chocolate, have high oxalate levels. Your liver also produces oxalate. Dietary factors, high doses of vitamin D, intestinal bypass surgery and several metabolic disorders can increase the concentration of calcium or oxalate in urine. Calcium stones may also occur in the form of calcium phosphate. Struvite stones. Struvite stones form in response to an infection, such as a urinary tract infection. These stones can grow quickly and become quite large, sometimes with few symptoms or little warning. Uric acid stones. Uric acid stones can form in people who don't drink enough fluids or who lose too much fluid, those who eat a high-protein diet, and those who have gout. Certain genetic factors also may increase your risk of uric acid stones. Cystine stones. These stones form in people with a hereditary disorder that causes the kidneys to excrete too much of certain amino acids, cystinuria. Other stones. Other, rarer types of kidney stones also can occur. Risk factors. Factors that increase your risk of developing kidney stones include family or personal history. If someone in your family has kidney stones, you're more likely to develop stones too. And if you've already had one or more kidney stones, you are at increased risk of developing another. Dehydration. Not drinking enough water each day can increase your risk of kidney stones. People who live in warm climates and those who sweat a lot may be at higher risk than others. Certain diets. Eating a diet that's high in protein, sodium and sugar may increase your risk of some types of kidney stones. This is especially true with a high sodium diet. Too much sodium in your diet increases the amount of calcium your kidneys must filter and significantly increases your risk of kidney stones. Being obese. High body mass index (BMI), large waist size and weight gain have been linked to an increased risk of kidney stones. Digestive diseases and surgery. Gastric bypass surgery, inflammatory bowel disease or chronic diarrhea can cause changes in the digestive process that affect your absorption of calcium and water, increasing the levels of stone-forming substances in your urine. Other medical conditions. Diseases and conditions that may increase your risk of kidney stones include renal tubular acidosis, cystinuria, hyperparathyroidism, certain medications and some urinary tract infections. Tests and diagnosis. Blood testing. Blood tests may reveal too much calcium or uric acid in your blood. Blood test results help monitor the health of your kidneys and may lead your doctor to check for other medical conditions. Urine testing. The 24-hour urine collection test may show that you are excreting too many stone-forming minerals or too few stone-preventing substances. For this test, your doctor may request that you perform 2 urine collections over 2 consecutive days. Imaging. Imaging tests may show kidney stones in your urinary tract. Options range from simple abdominal X-rays, which can miss small kidney stones, to high-speed or dual-energy computerized tomography (CT) that may reveal even tiny stones. Other imaging options include an ultrasound, a non-invasive test, and intravenous urography. Analysis of past stones. You may be asked to urinate through a strainer to catch stones that you pass. Lab analysis will reveal the makeup of your kidney stones. Treatments and drugs. Treatment for kidney stones varies depending on the type of stone and the cause. Small stones with minimal symptoms. Most kidney stones won't require invasive treatment. You may be able to pass a small stone by drinking water. Drinking as much as 2 to 3 quarts 1.9 to 2.8 liters a day may help flush out your urinary system. Unless your doctor tells you otherwise, drink enough fluid, mostly water, to produce clear or nearly clear urine. Pain relievers. Passing a small stone can cause some discomfort. To relieve mild pain, your doctor may recommend pain relievers such as ibuprofen, acetaminophen or naproxen sodium. Medical therapy. Your doctor may give you a medication to help pass your kidney stone. This type of medication, known as an alpha blocker, relaxes the muscles in your ureter, helping you pass the kidney stone more quickly and with less pain. Large stones and those that cause symptoms. Using sound waves to break up stones. For certain kidney stones, depending on size and location, your doctor may recommend a procedure called extracorporeal shock wave lithotripsy (ESWL). ESWL uses sound waves to create strong vibrations, shock waves that break the stones into tiny pieces that can be passed in your urine. Surgery to remove very large stones in the kidney. A procedure called percutaneous nephrolithotomy involves surgically removing a kidney stone using small telescopes and instruments inserted through a small incision in your back. Using a scope to remove stones. To remove a smaller stone in your ureter or kidney, your doctor may pass a thin lighted tube or a pteroscope equipped with a camera through your urethra and bladder to your ureter. Once the stone is located, special tools can snare the stone or break it into pieces that will pass in your urine. Parathyroid gland surgery. Some calcium phosphate stones are caused by overactive parathyroid glands, which are located on the 4 corners of your thyroid gland, just below your Adam's apple. When these glands produce too much parathyroid hormone, hyperparathyroidism, your calcium levels can become too high and kidney stones may form as a result. Removing the growth. Lifestyle changes. You may reduce your risk of kidney stones if you drink water throughout the day. For people with a history of kidney stones, doctors usually recommend passing about 2.5 liters of urine a day. Your doctor may ask that you measure your urine output to make sure that you're drinking enough water. Eat fewer oxalate-rich foods. If you tend to form calcium oxalate stones, your doctor may recommend restricting foods rich in oxalates. These include rhubarb, beets, okra, spinach, Swiss chard, sweet potatoes, nuts, tea, chocolate and soy products. Choose a diet low in salt and animal protein. Reduce the amount of salt you eat and choose non-animal protein sources such as legumes. Consider using a salt substitute. Continue eating calcium-rich foods, but use caution with calcium supplements. Calcium in food doesn't have an effect on your risk of kidney stones. Continue eating calcium-rich foods unless your doctor advises otherwise. Ask your doctor before taking calcium supplements, as these have been linked to increased risk of kidney stones. Medications. Calcium stones. To help prevent calcium stones from forming, your doctor may prescribe a thiazide diuretic or a phosphate-containing preparation. Uric acid stones. Your doctor may prescribe allopurinol to reduce uric acid levels in your blood and urine and a medicine to keep your urine alkaline. In some cases, allopurinol and an alkalizing agent may dissolve the uric acid stones. Stravite stones. To prevent stravite stones, your doctor may recommend strategies to keep your urine free of bacteria that cause infection. Cystine stones. Cystine stones can be difficult to treat. Your doctor may recommend that you drink more fluids so that you produce a lot more urine. If that alone doesn't help, your doctor may also prescribe a medication that decreases the amount of cysteine in your urine.